This video will focus on ethical principle number 3 outlined in BCCOHP's professional standards for the oral health team. The BC College of Oral Health Professionals protects the public by setting clear expectations for the delivery of safe, patient-centered oral health care. That's where BCCOHP's professional standards for the oral health team come in. They take a modern, unified approach on the minimum requirements for ethical and professional conduct of oral health team members. The professional standards are organized by overarching principles for oral health care that act as a guide for how to provide safe, collaborative, and patient-centered care. The third ethical principle is to be culturally aware, equitable, and inclusive. As an oral health professional, you have an ethical responsibility to recognize your patients' individual needs and to treat them fairly and without discrimination. This includes things like treating all patients fairly and not discriminating against any group of people based on gender, race, ethnicity, etc. Adhering to human rights laws and legislation, respecting your patient's identity, values, and beliefs, and creating safe spaces for them to receive care, taking steps within your practice to identify, address, and prevent discrimination and racism, and being cognizant of the lived experience of Indigenous people in BC and how Indigenous-specific racism within our healthcare system may impact their ability to receive care. So what does this look like? Well, it could include taking the time to speak with patients about their culture as part of your patient evaluation, incorporating measures such as traditional medicine where possible to ensure patients feel respected and included when receiving care, welcoming family, community members, and elders to support your patients, taking anti-discrimination and anti-racism courses with your oral health team to learn how to recognize and address discrimination and racism within your workplace, and having processes and policies in place, and speaking up if you witness discriminatory behavior, like a colleague making homophobic or racist remarks. This may include speaking directly to your colleague or your employer or reporting them to BCCOHP if their behavior negatively impacts patient care. For more information about your requirements as an oral health professional, please read BCCOHP's Professional Standards for the Oral Health Team document. Thanks for watching.